Good afternoon, everyone, and welcome to today's Medicare Live. So, today's topic is a good one. We're going to talk about what happens if you choose the wrong plan when you start Medicare. So, welcome. I'm glad you're here. And this is something that doesn't get discussed enough when people are turning 65 or starting Medicare. And the other thing we're going to talk about, and I think is the even more important part, is not just what happens if you choose the wrong plan, but more importantly, how hard is it to fix? So if you're turning 65 soon, if you're helping someone who is, or maybe you're just getting ready to start Medicare, type 65 in the comments. We haven't met yet. I'm Casey Album. I'm the Senior Medicare Advisor here at the Album Insurance Group in Margate, Florida. We're the family business behind Medicare, Medicare.com. And for over 30 years now, we've been helping people all throughout the country navigate Medicare and make their Medicare decisions with clarity and confidence. Many of my clients jokingly refer to me as their Medicare co-pilot, not just because I fly planes, but although I do. It's another way I'm following in my dad's footsteps, by the way, but it's because I'm sitting right next to them, helping them think through the decisions that impact them both today and down the road. And I'm with them for the entire journey, even if that's 5, 10, or 15 years down the road. So today's one of those think long-term conversations. If you've got questions, drop them in the comments as we go, and I'll take some time to answer them at the end. Grab your coffee or your favorite beverage, and let's get into it. So here's what we'll actually cover today. We're going to talk about what happens when you pick the wrong plan, why switching later isn't always easy, and why sometimes it's not even possible. We'll talk about the myth of I'll stay healthy and switch later, and we'll talk about the difference between network-based managed care and freedom-based Medicare coverage. If you've ever wondered how flexible Medicare really is after you enroll, type me in the comments. So when you first start Medicare, whether that's at 65 or older if you're coming off of a group plan, you have protections. If you choose a Medicare supplement plan, also known as Medigap, during your what we call that your open enrollment window, if you're 65, or your special enrollment window if you're older, you have a 6-month period from the date that your Part B coverage starts where you can get any Medicare supplement plan from any company that offers it, and you cannot be denied coverage. They can't ask any health questions. Doesn't matter what kind of pre-existing conditions you have. From the Medicare supplement company's point of view, within that 6-month window, they don't exist. But after that window, you could be denied coverage. Medicare supplement coverage is secondary to Medicare, so they can ask underwriting questions. Now, there's a couple exceptions, but as a general rule, in most states, if you try to switch from a Medicare Advantage plan to a Medicare supplement plan later on, you'll have to go through medical underwriting. That means health questions. That means possible denial if you answer yes to some of the health questions or something comes up in your medical records. Could be higher rates because you're going to be older. And it could also mean no ability to switch plans at all. And that's the part that you don't hear William Shatner or Joe Namath or any of those celebrities talking about in all those commercials. If that surprises you, type yes in the comments. Something I hear often is, I'm healthy now, I'm going to get the zero premium plan now, and then I'll switch later when I need more coverage. And it sounds good. It's very tempting because you think you're going to get the best of both worlds, right? But the challenge is simple. You usually don't get to switch when you want to. You're going to get to switch when your health allows it. But you're also limited to when the Medicare rules say you can. And if you have a network-based managed care plan, there's only 2 periods of the year where you can switch. I know your doctors can switch you out of the network at any time, and you can't. I know that's frustrating and it doesn't seem fair, but that's the way they set up the rules. And what happens is that means you get to switch during an enrollment period, but you also get to switch if your health allows it. And by that time, many people can't talk today. By the time many people want more flexibility, it's because they've typically run into some type of a health issue. They've started to experience some of the trade-offs that come with their network-based managed care plan, but that's also when underwriting becomes an issue. Now, this is not meant to be fear-based. It's just simple policy structure. And this is where freedom-based coverage really comes in. Medicare Advantage is network-based managed care, and it's the plan rules, not the Medicare rules, that govern where you can get care and whether or not the insurance company is even going to approve it. Medicare Supplement is freedom-based coverage, and with freedom-based care, you can see any provider nationwide that takes Medicare. And if that doctor thinks that it's medically necessary, Medicare is going to pay for it. There's no network restrictions, there's no referrals, you don't have to worry about fighting for pre-approvals. You also have more predictable costs, and that protects you from some of the thousands of dollars out of pocket that could really devastate your retirement plan. And this structure becomes even more valuable as we age, not less. And think about it, right? Statistically, as we get older, we're more likely to need care, and the care that we need is going to become more expensive. I saw this firsthand with my dad recently. My dad's 82, and he's in pretty good health, but he had been recently hospitalized, and when he was being discharged, and he's bouncing back, by the way. So those of you that have reached out and asked about him, thank you. But when he was being discharged, we were trying to get him set up with in-home physical therapy, and we had the case manager that was overseeing the discharge, and I think she just assumed he had an Advantage plan because she said, "Okay, guys, just sit tight. You're not going home right away. I've got to fight to get this approved. The insurance companies don't really want to approve anything. And then once I get it approved, I got to find an agency that'll actually take him." And then she looks at us and she's kind of downtrodden. She says, "Who's his insurance with?" Well, when she learned he had original Medicare with a Medigap plan, she smiled and she went to work. And she said, "It won't take me long. I'll be back." We were leaving the hospital in about 30 minutes. We had physical therapy already approved and scheduled for the next day. And one of the things she told us is that when someone has original Medicare, those, first of all, it's medically necessary. It's Medicare approved. So those healthcare agencies, they actually fight to take that case because they know they're going to get paid and they're not going to have to jump through a bunch of hoops. So you had the same exact medical need, in-home physical therapy, but two very different outcomes based solely on the type of coverage. Networks also matter because networks determine who you can and can't see. When you have original Medicare, there are no networks. So you can see any doctor anywhere in the country who accepts Medicare. And that freedom becomes even more important as serious medical issues start to pop up. I recently spoke with a woman. She was calling because she was helping her mom. Her mom was on a Medicare Advantage plan, and she desperately wanted to move her to a Medicare supplement. The problem was she was going to a large practice. It was one of these large practices where they have the doctors and they have their own pharmacy and everything else. And she had been diagnosed by a nurse practitioner with possible dementia. But they took it a step further and they prescribed a dementia medication, and that meant that it showed up in her medical records. The daughter didn't agree with the diagnosis, and she wanted confirmation from a specialist. But the problem, they couldn't see the specialist they wanted because they weren't in a network. They were also convinced that the diagnosis was wrong, but they couldn't easily get the right second opinion. And now she feels trapped because switching out to a Medicare supplement plan that would give her mom that freedom requires underwriting. And with the dementia prescription written and on her medical records, she's not going to pass. That was a really tough conversation because I really wanted to be able to help this lady, and I couldn't. And that right there is the difference between network-based managed care and freedom-based coverage. When everything is fine, when you're healthy, and when you're first enrolling, they can both feel very, very similar. But when something serious happens, the differences become very, very clear. If access to specialists and keeping full control over your health care matters to you, type access in the comments. Another issue people don't consider, Advantage plans often start with low premiums, sometimes zero. Yes, you've still got to pay your Part B premium, but on top of that, there's usually no additional premium. And that's because the costs show up differently. They're not free. You're going to have copays, coinsurance, out-of-pocket maximums that you need to meet before you're covered 100%. Over 70% of procedures on these plans require prior authorization before you can get care. And of course, there's network limitations. Freedom-based Medicare supplement plans, yes, they're going to cost more up front. but they're going to limit your exposure and remove a lot of uncertainty. Most maximum out of pocket limits on Advantage plans are several $1,000s. So if you have a serious health issue, you could be facing significant out of pocket costs. For many retirement plans, several $1,000s all at once could be devastating. A Medicare supplement plan, even with the monthly premium, is going to limit that exposure, and it's going to remove a lot of the uncertainty. For many financially comfortable retirees, that predictability is going to matter a lot more than some type of promotional pricing. So if you're approaching 65, if you're getting ready to start Medicare, or maybe you're already on Medicare and you're unsure about the plan you chose, this is the time to think strategically. And the same thing applies if you're helping a friend or a loved one, like me, maybe you're caring for your parents and helping them through some of these decisions. By the way, this is the same type of thing I went through with my mom when she retired. My mom lives in a rural area, and she worked into her late 70s. And for her, when she was retiring, she had a small retirement plan and Social Security. That was kind of her retirement plan, and she planned for that. But I knew for her there was a couple of things that were an important part of her Medicare strategy. Luckily, she knew who to talk to. But with my mom, one of the things I knew is she had certain specialists that she needed to be able to continue seeing because she had some chronic conditions that were very well managed. But she needed to be able to continue to see those specialists that have been treating her. So that was important. Networks were going to be an issue for her. And the other thing is she's in a rural area, and I didn't want her to be in a situation where maybe the local doctors didn't take her plan, so now she has to travel a couple of hours to go find someone that took her plan. And then the other thing was financially. My mom did a nice job of planning for her retirement, but I knew she'd be devastated if she had a really serious issue and ended up meeting the maximum out of pocket on one of those plans, even the in-network maximum, which is typically $5,000 to $7,000. So for her, there is no question a Medicare supplement plan was the right plan for her. And I know, because she lives in another state, I know that she has the flexibility to see any doctor that she needs to. I know she's not going to have to worry about pre-approvals and all that. And that gives me peace of mind, because if something happens, I know she's going to be able to get care, and I know that there's not going to be any restrictions or any appeals or anything else that we're going to have to hassle with. So it's peace of mind for me, peace of mind for her. And she's got a fixed monthly premium that she can budget for and know that she's not going to have any surprises. The biggest surprise with Medicare supplement plans is that the premiums typically end up being a lot more affordable than people realize. So if you want to think about this strategically, maybe you'd like some help or some guidance or a second opinion, my team and I'd be honored to help you. You can go to medicarequotes.com/Facebook, fill out your information, and we'll call you back, or you can even grab some time on our calendar. You can also call the office 954-970-4760. Liz or Christine will connect you with me, or someone on the team will get you on the calendar, or just comment info in the comments, and we'll reach out to you and take it from there. No pressure, just clarity. So I get a lot of questions, and this is a topic that I get asked about a lot. And some of the common questions that I get are, can I switch to a Medicare supplement later if I don't like my Advantage plan? Now, technically you can, and we're in one of those periods where you can. We're in what's called the open enrollment period. I mentioned that in one of my past live trainings, but that's kind of Medicare's do-over period. It's not as well known as the annual election period in the fall, but you basically get one chance to change out of an Advantage plan and get a different one, or go back into original Medicare. If you're healthy and you can pass underwriting, this is an opportunity for you to make that switch. But underwriting, as I mentioned before, underwriting does come into play. That's why if you're healthy now, that's when your options are the best. The best time to enroll in a Medigap plan, of course, is within that first 6 months of starting Medicare or any other type of one of those limited special enrollment windows. The second best time is now if you're healthy. And again, if you'd like help, feel free to reach out to us. We'll be glad to walk you through it and see if it even makes sense for you to switch. Are Medicare Advantage plans bad? Not necessarily, but they're structured very differently. The real key is understanding whether network-based managed care fits your lifestyle and your risk tolerance. How important is that lower zero premium in exchange for the freedom and flexibility that you're going to have to give up? How comfortable are you with the lower monthly premium but the higher out-of-pocket exposure? These are all trade-offs, right? I mean, I'm not going to say that they're bad, but they're very, very different. For most of the people that I talk to, anyone in my family, I'm not going to recommend one of those plans. I'm going to recommend original Medicare with a Medicare supplement plan. And by the way, there are different Medicare supplement plans that provide different levels of coverage to fit into just about each and every budget. What if I already chose a plan and I'm unsure? Well, there may still be options depending on timing and health. The earlier you review it, the better. And again, right now, if you're on an Advantage plan and having second thoughts, which that happens a lot this time of year, as people start to use their plan and see that it's even different than the one that they had last year, you can make a change. You can make a change up to March 31st, but it's health dependent. So the earlier you review it, and if you're making a change, the earlier you apply and make that change, the better, because you want to do it while you're healthy and protect your health. So here's the big takeaway. The Medicare decision that you make at 65 or when you first start Medicare, that's going to quietly follow you all throughout retirement. And it's going to determine how flexible you're going to be able to be when you as far as traveling goes, which doctors you're going to be allowed to see, and essentially what health care you're going to be allowed to get. It's a big decision, and you don't have to make it alone. And if you've made that decision and you want someone to help you reconsider, you don't have to do that alone. A trusted guide can help you think long term, cut through all the marketing noise, and help you build or revise your Medicare strategy so that it protects your freedom, your access, and provides you with that financial predictability. And if you'd like help doing that, my team and I will be honored to help you. Again, you can just go to medicarequotes.com/Facebook and book an appointment or have us call you back. You can call the office 954-970-4760 or simply type info in the comments and my team and I will reach out to you. We'll be glad to walk you through it. Thank you so much for spending a few minutes with me today. I will see you next Wednesday at 3 p.m. Eastern Time with our next Medicare Live. Have a great day, everybody.